Did you know that some common night habits can quietly increase the risk of sudden death during sleep, especially in seniors over 70? As we grow older, our bodies become more sensitive to changes in environment, medication effects, and internal imbalances. Unfortunately, nighttime can be a vulnerable period when these issues go unnoticed. In this video, we'll explore the most dangerous nighttime habits seniors should avoid and how simple changes can make sleep safer and healthier. First, let's talk about why sleep becomes riskier after 70. With age, the heart becomes more fragile, blood pressure regulation shifts, and breathing can become irregular, especially in those with conditions like sleep apnea or heart disease. The nervous system isn't as quick to respond to drops in oxygen or sudden heart rate changes, making nighttime health crises more likely and more dangerous. That's why it's essential to understand which bedtime habits can trigger these hidden risks. One common but dangerous habit is sleeping in a room that's too cold. Seniors often have a reduced ability to regulate body temperature. A cold room, especially below 65 degrees Fahrenheit, 18 degrees Celsius, can strain the cardiovascular system. Cold temperatures may lead to constriction of blood vessels, causing increased blood pressure and a higher risk of heart attack or stroke during the night. If you or a loved one tends to get cold at night, aim to keep the bedroom comfortably warm. Use layered bedding and avoid sleeping near drafty windows. Another habit to avoid is taking certain medications right before bed without medical advice. Some common prescriptions, like sedatives, muscle relaxants, or blood pressure meds, can drastically slow heart rate or breathing. When taken late at night or mixed with alcohol or over-the-counter sleep aids, they can increase the risk of respiratory depression or irregular heartbeat. Always review your medications with a doctor and ask specifically about nighttime safety. Irregular sleep patterns also pose risks. Seniors often nap during the day, but inconsistent sleep cycles at night can disrupt heart rhythms and affect hormone balance. A proper sleep routine, ideally sleeping and waking at the same times each day, helps maintain stable circadian rhythms and lowers the risk of sudden nighttime arrhythmias. Let's not forget about sleep apnea, a silent killer that often goes undiagnosed in older adults. If you or your partner notice loud snoring, gasping, or frequent awakenings at night, it's worth getting checked. Sleep apnea causes drops in oxygen that can trigger heart failure or stroke in severe cases. A sleep study and proper treatment, like a CPAP machine, can be life-saving. One overlooked danger is getting up too quickly during the night, whether to use the bathroom or check something. Seniors often suffer from orthostatic hypotension, a sudden drop in blood pressure when standing. This can lead to fainting or even cardiac arrest. If you need to get up during the night, sit on the bed for a moment first, then stand slowly and use a nightlight to prevent accidents. Lastly, avoid heavy meals or alcohol before bedtime. Both can interfere with sleep quality, disrupt heart rhythms, and contribute to acid reflux, which can also affect breathing. A light snack is fine, but try to finish eating at least 2 to 3 hours before sleep. In summary, staying safe at night after 70 isn't about fear, it's about awareness. A warm, stable sleep environment, consistent routines, proper medication management, and addressing breathing issues can all go a long way in preventing nighttime emergencies. If you're caring for a loved one or you're a senior yourself, these tips can make a world of difference. If you found this video helpful, don't forget to like, subscribe, and share it with someone who needs to hear this. Your small action could truly save a life.